welcome to Doctors Today talk show, where we bring real life issues as it is. This is your host, Alice. And today we have a guest panel, Patricia Lingige, who is an experienced doctor of public health and currently doing some research on an ongoing topic of breast cancer. So welcome, Dr. Patricia.
Thank you.
So tell me, what is breast cancer?
Okay, let me first begin by saying that breast cancer has been a persistent health issue in many developed and developing nations around the world. And it's the second most form of cancer in the U.S., falling just behind skin cancer. And that's why it's an important disease to discuss. So basically, as we all know, cancer is uncontrolled division of cells. And this buildup of extra cells often form a mass of tissue, and that is what we refer to as a lump, a growth of what we call a tumor. Tumors in breast can be benign, which are the non-cancerous, or they can be malignant, which is the cancerous type of cancer. And the benign type of cancer basically is the non-invasive, and though it grows, it can be removed, and chances are they might not grow back. But in malignant type of cancer, they are the invasive type of cancer that can spread to other parts of the body, and though they can be removed, there's a high chance that they will grow back again.
So what causes breast cancer?
Well, no one knows exactly the causes of breast cancer, but as we'll see in the risk factors, hormones have been thought to play a role as promoters of breast cancer.
I once heard that wearing a bra can cause breast cancer. Is that true?
Actually, that is just one of the many myths that we have, and so far we've not had any scientific research or studies to back up that claim, so I don't believe that wearing a bra could cause breast cancer.
Okay. So what are some symptoms of breast cancer?
Well, some of the symptoms include masses or lumps on the breast, pain, erythema, which is the redness of the skin, nipple drainage, and enlarged lymph nodes. The most common complaint which causes women to seek medical attention is the breast mass.
So on that note, how do they stage breast cancer?
Well, as I mentioned earlier on, enlarged lymph nodes are one of the symptoms of breast cancer. These lymph nodes are also the key factors in staging breast cancer and determining the prognosis of a patient. Basically, I'll just briefly discuss the stages of breast cancer, which include stage 0, which is sometimes used to describe abnormal cells that are not invasive cancer, but if not treated, they can grow to become invasive. Stage 1 is an early stage of invasive breast cancer, but the tumor is no more than 2 centimeters. Stage 2, the tumor is either no more than 2 centimeters or between 2 to 5 centimeters, and the cancer has spread to lymph nodes under the arm. The tumor could also be larger than 5 centimeters, but has not spread to the lymph nodes under the arm. In stage 3, it's divided into 3 parts: stage 3A, 3B, and 3C, and basically there's the locally advanced cancer that is a tumor of any size and has spread to other parts of the arm and under the breastbone. And the last stage of cancer, which is stage 4, is the cancer that has spread to other parts of the body, for example, the bones and the liver, and the size of the tumor is not applicable in this case.
Oh, so that's really interesting. Tell me, what's the prevalence of this disease and what are some of the risk factors? Is it a disease for everyone?
Well, although breast cancer occurs in men and women, the prevalence is low in men. Out of 100 women diagnosed with breast cancer, only 1 man gets the disease. White women are also at a higher risk of getting the disease compared to their counterparts, and the reason for this has not yet been discovered. Also, the general international pattern of breast cancer incidence reveals higher rates for Western industrialized nations and lower rates for less industrialized and Asian countries. So answering part of your other question concerning the risk factor, some of the risk factors that have been studied include the age. So as a woman grows older, there's a higher chance of her getting the disease of breast cancer. Family history has also played a role, and 5 to 10% cases of breast cancer have been related to strong family history of relatives with breast cancer. Also, certain genomes in certain genes such as BRCA1 and BRCA2 increase chances of breast cancer. Other risk factors include reproductive and menstrual history among women who've never had children, who've had their first children at an older age, who've had their first menstrual period before the age of 12, who went through menopause after age of 55, and finally women who take menopausal hormone therapy for many years. Other risk factors to consider of breast cancer include alcohol intake, which increases your chances for getting breast cancer, and also being overweight and obese, and lack of physical activity has also been shown to increase the risk of breast cancer.
So how is this disease diagnosed?
Some of the methods used to detect the disease include clinical breast exams, whereby your healthcare provider checks your breast and looks for differences in size or shape between your breast. Any other abnormal signs will be looked for, such as lumps that are abnormal. Mammograms, which is an X-ray picture of tissues inside the breast, is also commonly used. And women above the age of 40 or women in the middle age of 40s are recommended for regular screening every 1 to 2 years. And also, women with a strong family history of breast cancer are also recommended for this screening. Ultrasounds are high-frequent sound waves that view sections on the breast tissues to show any abnormalities, and these are also used to detect the breast cancer. When abnormal tissues or region is identified, a needle is inserted and cells are sought out for examination. Needle biopsy is taken if a diagnosis cannot be made on this study of the tissue. And the last one is self-examination that can be performed by an individual, especially when you know how your breast feels. It's easier to perform a breast self-examination. And one thing to remember concerning breast cancer are the ABCs of breast health. A stands for screening mammogram, B for breast self-examination, C for clinical breast examination. And remember that a breast examination can surely save your life.
That's really good. So down to our last question, how is this disease treated, and are there any ways of preventing it?
Well, there are several treatments options that women with breast cancer can choose from. One of them includes surgery and radiation therapy, which are types of local therapy that remove or destroy cancer in the breast. Hormone therapy and chemotherapy are what we refer to as systematic therapy. The drug enters the bloodstream and destroys or controls cancer throughout the body, and chemotherapy is recommended especially before surgery since it slows the growth, the cancer growth. Another form of treatment is mastectomy, which is performed if there's more than one tumor on the breast. Basically, this surgery for the part of the breast that is removed, and if preferred, a woman can have a breast reconstruction surgery that can be performed, and tissues can be replaced by implants or patient's own living tissues. So down to the prevention, while it's not possible to completely prevent the disease, it's possible to reduce the risk with a hormone called tamoxifen, which has been proven to work for most women who've previously had cancer, and it prevents the reoccurrence of cancer, and it's also been shown to prevent cancer among women who are at a high risk of getting the disease.
Thank you, Dr. Patricia, for being here with us tonight. I hope you all enjoyed the show, and watch us for our next show, where we'll be talking about diabetes. So see you next time. Thank you.
Thank you.